budget hearing for the Department of Health. And our director is, of course, Dr. Gregory Branch. And we have budget office analyst Valentina Washington. And we have our legislative, analyst Zachary Ahmet. We had you for another agency the other day, so good for you.
Madam Chair.
Yes.
Yeah, it's Wade Catch. I would like to ask our secretary a couple questions first.
Before we start? Okay.
Yeah. All right.
Mm-hmm. Yes.
Mr. Secretary.
Tom Boswick, are you there?
Yes, sir.
Number one, it's true that the council must pass a balanced budget. Isn't that true?
Mm-hmm.
Yes.
Yes. With the revenues that were projected by the administration, they're being revised. When we vote on the budget, what revenues will be in the budget that we vote on? Will they be the original revenues from the administration, or will they be more updated revenues?
Well, the charter does not allow the council to alter the.
Somebody has to mute the microphone because I can't hear.
Yeah, I can hear you there.
Can you hear me now?
Yes.
Okay. The county charter does not allow the county council, the section of the budget, the budgetary and fiscal procedures section, it does not allow the council to alter the revenue projections. So we have to, in effect, live with what we are given in the executive's overall budget proposal. But I think before you vote on it, certainly I think the executive can alter those projections if it's appropriate to do so. So that's where we are with that.
That answer your questions, Councilman Ken?
Well, when the budget is printed, let's say that the administration, and I know they're updating the revenue picture, will the revenues in the printed version be the updated revenue numbers or the ones as originally proposed by the county executive?
Sorry, muted. That is a question I believe that needs to be answered by the administration, whether they are going to alter those projections or not.
And that's important because if we don't know, I mean, the sooner we know what the revenue picture is that the administration is going to have us use, then we'll know what changes we have to make in spending or whatever, because we're mandated to pass a balanced budget. Correct?
Correct.
Ed, do you know if the administration is going to have us use your new numbers from next week or the ones from the date that the budget was originally introduced?
Is this a question for me or for Lauren?
I was actually asking Ed.
Okay.
Is Ed there? Well,
Madam Chair?
I think it's away from his desk. He's not answering.
Yeah, he must be, but he is on the meeting.
Mhm. So maybe you can ask him at another time.
Yeah, and Madam Chair, please, as soon as you can, could you get this issue settled one way or the other, of what revenue numbers we're going to be using? We need that before we vote on any amendments and obviously before we vote on the budget. Thank you very much.
Thank you.
Madam Chair?
Yes, Councilman Jones.
Yeah, I guess a point of clarification I think is worth noting. Mr. Boswick, you can correct me if I'm wrong, but you said we have to accept the numbers that the administration has provided. But that does not mean we cannot go further in our cuts if we believe the situation is different than what was provided. In other words, by statute, we must have a balanced budget, but nothing says we can't cut more. Is that correct?
That is correct.
All right, thank you.
Okay, anyone else before we proceed?
Madam Chair, I think, thank you. I think Councilman Catch has asked a really good question and agreed with Councilman Jones that we can cut further, but we don't even know what further is at this point because we don't have an accurate revenue projection to work with. So in a way, we're shooting in the dark here in terms of what is a thoughtful budget recommendation from this council, because we don't have sufficient information to make a thoughtful recommendation.
Okay, let's have this conversation at another time between the members, and let's get on with the budget hearing for the health department. Zachary, the floor is all yours.
Thank you, Madam Chair. The proposed FY 2021 budget for the Department of Health totals $91.3 million, a decrease of $13.1 million or 12.6% from the FY 2020 budget. The general fund portion decreases by $26,000 or 0.1%, primarily due to decrease in FY 20 COVID-19 overtime expenses offset by other personnel changes. The special fund portion decreases by $13.1 million or 16.4% due to FY 2020 COVID-19 grants offset by additional funding in 2 grants. This analysis identifies one maximum potential operating budget reduction totaling $2.5 million, which we identified as pandemic accounting reductions. This reduction, beginning on page 5, relates to new pandemic economies that we've entered, which explores how various actions might affect the department. The purpose of presenting them is to give the director an opportunity to discuss the operational impacts of large-scale funding changes so that possible staffing and service level effects of lost revenue can be understood by all. Other discussion issues follow in the budget package beginning on page 7, which cover COVID-19, the opioid epidemic, personnel grants, and animal services. We've also included a homeless grants issue to explain the transfer of the homeless shelter contracts from the Department of Planning to the Department of Social Services. At this time, I would like to turn it over for discussion.
Thank you very much. Do any of the members have a question or comment for Zachary at this point? Okay, hearing none, we'll move on to Dr. Gregory Branch, the director of our health department. Dr. Branch, how are you today?
I am doing well.
Good, that's good to hear. Will you give our best to all your staff in the health department and your frontline workers from the county council?
We will do that. I will definitely do that.
Okay, thank you. And I'm sure you want to defend your budget. The floor is all yours.
So now, well, good afternoon, Chairwoman Devins and council members. Thank you for this opportunity to come before you today on behalf of the Department of Health and Human Services. Whenever I'm before this body, I always mention that HHS is on the job. And HHS is on the job. It's just not a slogan or a tagline I like to use. I make it a point to tell people that HHS is on the job because I'm pointing out a statement of fact. It's a statement of fact that I've always shared with a sense of pride. But today, I not only say it with a sense of pride, but also a sense of appreciation, conviction, quite frankly, awe. The work that is being done by our staff as we lead the county's response to the COVID-19 pandemic is awe-inspiring. I'll share a bit more about that in a few minutes, but first I would like to introduce my leadership team. On call to WebEx today, I have Della Leister, the Deputy Health Officer, Mark Millspaugh, the Deputy Director of Social Services, Terry Hay, the Deputy of Housing and Community Development, and Lawrence Richardson, my Deputy Director of Finance and Administration. And thank you for joining me, team. As I mentioned earlier, I'm very proud of our team and the work that they're doing to mitigate the impact of COVID-19. I'd like to take a few moments now to give you a high-level overview of how HHS is continuing to act. ACT, to save lives. A, we're advising. We advise leaders, community members, and employees about the COVID-19. C, we're controlling the spread through contact tracing, testing, providing PPE, and disease and social distancing education. And our T is treatment. We're supporting our nursing home and other congregate care facilities, hospitals, continuing need for behavioral health programming. And once it's available, we will be administering the coronavirus vaccine. We, in an unprecedented pandemic, as of this morning, Baltimore County had 3,667 confirmed COVID-19 residents, 182 COVID-19 related deaths. 48% of those deaths are from African Americans, and 75% of the deaths are nursing home related. Now, disease investigators have begun tracking COVID-19 in early December. And in January, we were participating in regular updates and planning sessions with our federal, state, and local partners. In February, we were updating county-wide leadership. We were distributing health office notices and sending reminders about the importance of observing healthy personal hygienic practices to our schools, the Department of Correction, YMCA locations, and the general public. In March, we opened our COVID-19 line. It operates 7 days a week and has received approximately 6,400 calls as of yesterday. We formed a health incident management team comprised of 9 separate operational command units that cover every aspect of our COVID-19 response. We've reassigned 119 staff, and now we have over 250 staff working on COVID-19. We initiated a county-wide staff absenteeism process in order to track the potential transmission and spread amongst county employees. We've reached out to all of our food establishments and continue to be in touch with them to ensure adherence to the COVID-19 guidance and safety protocols. We've implemented screening protocols at county homeless shelters and relocated at-risk homeless individuals to alternate safe housing, specifically hotels. We've provided support to nursing homes and long-term care facilities that help mitigate outbreaks. And we've activated a bulk shipping site where we continue to receive PPE, that's personal protective equipment, and we distribute those supplies to facilities and our healthcare partners across the county, including our residents and staff of shelters. By April, nursing homes had more than 73% of the COVID-19 deaths. We continue to issue guidance to these facilities and monitor their CDC recommendations and procedures. We've also opened 4 testing sites across the county in a little over 2 weeks. The site locations are Liberty Family Resource Center, the Maryland State Fairgrounds, the Maryland Vehicle Admissions Program in Owings Mills, and the Dundalk Health Center. These sites provide safe, efficient, and accessible testing Monday through Friday to over 500 individuals each week. They are located in some of the communities hardest hit by this pandemic. It's true that we ancient Mayflowers produced by the April showers. That same anxious expectation drives us towards the county's reopening. We are making preparations for a cautious reopening that will avoid a resurgence in the transmissions of COVID-19 cases. My role as the health officer is to advise the county executive following the guidance from the CDC, Maryland Department of Health, and the surveillance information from my department, specifically the information regarding contact tracing, testing, PPE needs, and the support for the long-term care facilities and hospitals. We're also beginning a coordinated outreach effort that will help to place PPE materials in the hands of people who have been disproportionately affected by this pandemic. During this pandemic, data has played a significant role in our response. Working with our epidemiologists and the county analysts, we have been able to focus on community efforts where we see it the most. African Americans make up 30% of Baltimore County's population, yet nearly 50% of deaths are from African Americans who have the disease. These numbers are especially high along the Liberty Road corridor, which is why we opened test sites at the Liberty Family Resource Center and the Owings Mills location. Working with a private nonprofit, we are looking to distribute tens of thousands of safety kits in the African American communities in the coming weeks. These safety kits contain masks, protective gloves, and valuable information on helping to stop the spread of COVID-19 virus. HHS continues to be on the job, helping to take care of some of our most vulnerable residents. Now, let's talk specifically about the budget. I respectfully disagree with the auditor's proposed cuts. In fiscal 2020, the department could not get through the year with what was allocated to meet critical needs, so we had to request a supplemental appropriation. Now, the budget proposed by the auditors for fiscal 21 is starting with even less than what we had in fiscal year 20, and we are in the middle of both an epidemic of opioids and a pandemic, COVID-19. Now, I must say I'm proud to oversee an agency that has been fulfilling its mission despite a flat general fund budget for many years. However, the department cannot withstand a $2.5 million cut proposed by the auditors. How do you expect me to look at my registered nurses, look at the disease investigators in their eyes, who are on the front line in the midst of this COVID pandemic, and tell them that they won't get a step increase and they won't get their longevities? And to add insult to injury, the auditors identify positions subject to a freeze. Let me be very clear. All of my positions in the Department of Health and Human Services are essential. These positions are the backbone to the department's function. Every time you freeze one of these, you immobilize our ability to get our jobs done and serve the community. Whatever you do, do not cut any funding to health and human services, especially during times of an epidemic within a pandemic. The Department of Health budget is $90.8 million. Of that amount, $66.7 million is grant funding. Our Department of Social Service budget is $17 million, with more than half, $8.6 million, from grant funding. The budget of Office of Housing is $85 million. All of it is grant funding. And the same holds true for the budget supporting our local management board, $2.7 million, all in grant funds. As you can see, the Department of Health receives a great deal of grant funding. At our last state audit of $95 million, the Department of Health received no audit findings. I also need to remind you that each month, Baltimore County Department of Health and Human Services distributes $10 million per month in food stamps, $6 million per month in housing vouchers, and millions more in WIC and other assistance programs. All of these funds come from federal sources and are spent right here in Baltimore County. National Public Radio recently published an opinion piece titled, "Always the Bridesmaid, Public Health Rarely Spotlighted Until It's Too Late." And that's often true. And it's the reason why I take advantage of every opportunity to highlight the work that we do. Truth be told, doing our work as well as we do is both a blessing and it's also a curse. Doing the work well is a blessing for the countless many that depend on us. And yet, doing the work well can also be a curse when it's time to make decisions on dividing limited resources. Our efficiency can lead to misinterpretations about our true needs. The total health budget for fiscal year 2021 represents an increase of $8.6 million. Let me be clear, $7.6 million of that increase is all grant funding. And the other $1 million comes from the general fund and is driven primarily by contractual services, labor agreements, and step increases, not services to our constituents. As always, we are working to build an even stronger health and human services by utilizing the budget available to us and by leveraging existing resources. For example, in support of the County Executive Strategic Plan, which focuses on developing new community partnerships, we are dedicating a Social Worker 3 to coordinate program and community services to our most vulnerable adults. We are further enhancing our community partnerships through a coordinated effort to strengthen our presence in the underserved communities greatly affected by the pandemic. And in an effort to provide strong collaboration among programs that serve like populations, we're moving from a bureau organizational structure to a population health structure. This health reorganization will support a more comprehensive and integrated service response. Similar reorganizational efforts were done at Animal Services and have already produced improvements, including an increase in our live release, better community supports, an increase in our volunteer supports, and better communication and management of the field response operators. Since Animal Services has reverted back to Health and Human Services, the number of complaints have significantly decreased, and we have forged a more collaborative partnership with the advocate community. Additionally, we work with our sister agency, the Department of Planning, to transfer the Housing and Community Development Program to our Department of Health and Human Services. This transfer creates efficiencies in the operation and administration of the county's homeless shelters. It improved our coordination between programs and services that were already located within social services, and it provided for a more robust response around managing matters related to COVID-19 and its effect on the homeless population. So, while COVID-19 has captured every headline and every news report of late, we must not be lulled into believing that opioids and substance use disorders are no longer a critical concern. The fact of the matter is that we have an epidemic of opioids within a pandemic of COVID-19. When we met a year ago, I shared with you the 3 essential tools needed to combat the opioid epidemic: residential beds, medication-assisted treatment, and recovery housing. We now have residential beds. Gardenzia is officially open, and we are providing medication-assisted treatment both in our communities and in our detention center. But we need to continue to work on securing recovery housing if we are to win this war against opioid misuse. In the meantime, we are using other tools to make progress. For instance, we've secured a 3-year grant from the Center of Disease Control to help address this fatal epidemic in our county. The grant is supporting the development of a just-in-time database that will be utilized by multiple county departments to assist in implementing prevention activities. The database will also enable multiple agency first responders to efficiently determine necessary steps to link individuals to care. We also brought on our Human Services Program Administrator to be responsible for planning and executing surveillance and prevention activities, coordinating personnel, and overseeing grant deliverables and budgetary requirements. Be rest assured, despite the COVID-19 pandemic, we have not forgotten about the battle against opioids and the toll it takes on our family, on our friends, and on our loved ones. We will continue to fight until the war is won, and we solicit your ongoing support in that arena. Since COVID-19, the spotlight has dimmed not only on the opioid epidemic, but the pandemic has pushed other major concerns further away from view. Let me remind you, tuberculosis, gonorrhea, chlamydia, hepatitis, lost and rabid animals, health insurance needs, diabetes, and other health concerns continue to be addressed by the department. Those diseases have not miraculously disappeared. One of the things we keep talking about and hearing about is the expectations for our economy post-COVID-19. As predictions about a recession momentum, so must our ability to plan for what it will mean for our county and our communities. Those we are currently serving are generally hardest hit during a recession, and they will continue to need our support. But they will be joined by countless others who a few short months prior thought that they would never find themselves at our doors. The needs brought on in an economic downturn are far-reaching. We need to prepare for people who look to access our cash assistance programs, WIC programs, transitional housing services, job training, emergency shelter services, energy assistance, behavioral health services, emergency rental assistance, burial assistance, and our SNAP program, formerly known as food stamps. Let me just give you some examples of the impact that COVID-19 already had. For our WIC program, in February, we had 14,000 clinic visits. In March, we had 15,000 clinic visits. And in April, we had 16,000 clinic visits. For our substance-exposed newborns, in the first 9 months of fiscal year 20, we have already served as many families with substance-exposed newborn as we did in the entirety of fiscal year 19. Food stamps. We average between 2,400 and 2,700 food stamp applications a month. Our highest month that we've had was in July of 2010, when we took about 3,500 SNAP applications. Ladies and gentlemen, during April, just last month, the department took 22,000 food stamp applications. That's not statewide. For Baltimore County alone, 22,000 applications in 1 month. Our communities, our neighborhoods, and our people are struggling. And to make matters worse, there are other invisible impacts brought on by recession. We have an increased number of adults and child abuse and neglect cases, an increased number of children brought into foster care, an increase in domestic violence. And all three of those are driven by the economic stress and the impact on mental health. Our phones are ringing off the hooks. And if they have not already started, soon your phones will also be ringing off the hook. And you'll be calling me on behalf of your constituents. And unfortunately, we just don't know how long this is going to last. I need you to know now that HHS is prepared and we are on the job. So in closing, the NPR piece that I mentioned earlier highlights the fact that in the wake of September 11th terrorist attacks and the anthrax attacks that followed, strengthening public health was a top priority. However, it did not remain a top priority. My hope and my prayer is that our present day circumstances, the opioid epidemic, the COVID-19 pandemic, and the resulting economic downturn will help us to ensure that health and human services remains at the top of the priority list. Thank you, and God bless you.
Thank you, Dr. Branch. Thank you for painting us a very detailed picture of what's happening in health and human services, especially with COVID-19 at the top of your list, but not also forgetting all the other important things that fall underneath of your agency as well. I have a few questions myself. I'd like to start. I was grateful to hear about the additional testing centers on the west side of the county. And I was looking at some of the numbers on the east side, and I thought that some were particularly high in the Dundalk, Essex, Middle River, Parkville area. And I was wondering what number needs to be reached, if any number, to have a site on the east side. And would you think it would be necessary anytime soon?
We do have a site on the east side. It's the Dundalk Health Center, and we've already started that there, yes. However, those are our sites.
Right.
There are a plethora of other sites of private organizations and hospitals that have it across the county. So that if you look at all the different sites that we have across the county, we have a goodly representation.
I guess I'm inquiring for folks that don't have a doctor, that don't have a referral? Are those the people that can come to our sites?
So what happens at all of the sites now that we have, you have to have a primary care provider or some type of doctor to write it because we are limited on tests. However, when they call us, we do refer them to the federally qualified health centers so that we can go there. And there are other sites that they can go to that they can actually get it. And I know that Rite Aid just opened a site in Baltimore County where if you just go on to Rite Aid, you can actually schedule an appointment to get a test, and it's free.
That's wonderful. Do you know where that location is?
Okay, I can give you the exact address, but I know it's in Baltimore. It's the only one in Baltimore County. So if you go on riteaid.com, but I'll get you that the definite information on that.
That's wonderful to hear. My second question is, as we all know, yesterday the governor spoke to the state of Maryland and talked about several phases of his rollout. And I guess my question to you is, will we be following those exact suggestions or his new policies for entering, going back to work, visiting restaurants, going to gyms, or is Baltimore County going to roll out their own plan and their own phases?
Baltimore County is definitely going to roll out what we think is best for Baltimore County. So we do follow the guidance of the Maryland Department of Health and the governor. So at this particular time, I must say, as the health officer, I am concerned because the indicators to lessen social distancing are still actually going up and not coming down. Specifically, the number of positive COVID clients that we have, the deaths, the hospitalizations, the fact that we don't have enough testing so far, our contact tracing is not in total force, and it's not enough PPE. So yes, we are going to follow the governor. However, overall, when people are out in public, they're going to have to maintain that 6 feet distance. And they're going to have to not have more than 10 people. So if they go to the park, that's not a problem, but they got to now have not more than 10 people playing that game with them and maintaining the 6 feet distance.
Thank you. And can you tell me, in your opinion, what is contributing to the higher numbers in our nursing homes?
What happens is that we know for COVID-19 that people who actually do worse with that disease are people with chronic health conditions. And unfortunately, in the nursing home, many of those people, if not most of them, have those chronic health conditions, and they are in congregate care, being taken care of by different people. So that what happens is that when all those different visitors and staff and everybody's coming into the nursing home, it gets spreads the COVID-19. And that's why it was so important to shut the visitation down and stop staff from coming from a nursing home, the next nursing home, to the next nursing home. So that's what it is. The reason why we're having so much of a problem is congregate care, and those people in that congregate care have a lot of chronic illnesses.
Do you think it was brought in more by staff or by family members of visitors, or you don't know?
We don't know, but I would tell you it's everybody. I think it's staff, I think it's nurses, nursing assistants, doctors, it's the whole kit and caboodle, plus it's all the family members, right? We love our family, we want to go visit them, but if you're coming in, and what we're finding out now, Councilwoman Beth, which is very important, remember initially, we thought that COVID-19 was only spread when a person was symptomatic. Right? This is a new virus. And what we've come to find out in a couple of months is that, in fact, people were asymptomatic and spreading it. So I've had people going into a nursing home who were not symptomatic at all, but they were actually spreading the disease. And we didn't know that then.
And that if they would have been tested that day, they would have been positive with no symptoms.
Right.
I'm going to guess that my colleagues are probably all experiencing the same thing as I am. The longer we're in, I've been in since March 1st, the longer we're in, the more restless people are getting. And although the numbers are still going up, I look at it every day and see where we're increasing. So we haven't done that plateau yet. We're still rising. There are people, even in the nursing profession, and everybody has an opinion that we need to get out and get back to work. And you got to start somewhere. And I keep relying on people like you and everyone else to tell me when that's going to be okay. So I don't know the message. I'm sure that you can tell us a message so we're all on the same message, what we should be telling our constituents that are really restless for whatever reasons, whether it's financially, it's such a hardship. We are very fortunate. We're still working, but there are so many people not working and, don't know how they're going to make ends meet. And there are some that just don't want to be in the house anymore. They want to get back to some kind of normal life. So what would you advise that we tell our constituents who are starting to feel this restlessness?
Right. Basically, what I say is we've got to be patient. This is a matter of life and death. But whatever they do, they should remain 6 feet away from the other person. They should never be in an area with more than 10 people. And they should always wear their masks.
When they're around anyone.
Right. At the point now, what the governor says is obviously if you go into a store, that type of thing, you got to wear your mask. But if you're just feeling anxious and you just got to go out and you want to run around the corner and all that kind of stuff, go ahead and do that. However, 6 feet away from other people, less than 10 around you, and wear your mask.
I myself have not seen any of my grandchildren for a very long time, or children, and that's the sacrifice I'm willing to make sure that they're safe and I'm safe. They're all still working. They're not sheltered in place, so I think that they are more susceptible to catching the virus, so we're all being very careful. I do know people that are letting their grandchildren visit because they're just tired of not seeing their grandchildren, and starting one by one to let people in and, have coffee and just sit on the porch and chat. And that makes me very nervous. And should it?
Well, I think you got to be very careful because this is a new virus. And unfortunately, we thought at the beginning of this, it really wasn't affecting children. But then I'm getting some studies out of New York where there's this new inflammatory syndrome happening with children, right, with COVID-19. So so at this point now, I just believe as the health officer that it's in our best interest to be able to continue the social distancing and continue to stay at home at this point now, because there's so much about the disease that we don't know.
True. And I did see that last night for the first time. And fortunately, there have been no children die from it so far, and they're still trying to learn. But it was horrific to see those children and the shape that they were in from that. And they said it was affiliated with the COVID-19 virus. So it was pretty scary. It was the first I ever heard of it. Well, thank you so much. And the only thing I would like to add, not talking about COVID, is going back to the opioid epidemic and treatment. I want you to know that we're still working very hard to get those beds in Eastern Baltimore County. And I'm hoping that works out. And I'm hoping that will be a model for the rest of the county, so we can start getting people well and back to being productive folks in society. So thank you for all your help on that. And also, Mr. Bromwell, thank you.
Amen. Thank you.
Okay, are there any members? Councilman Jones has his hand up first. Councilman Jones, it's all yours.
Thank you, Madam Chair. And Dr. Branch, I'd just like to thank you and your staff for doing the most excellent job. And your presentation today was very sobering and extremely informative. It was a good reminder, when everything seems to be coronavirus, and it's sucking all the air out of the room. It was a very good, sobering reminder that opioid epidemic, hepatitis, STDs, and many other issues that ail our community and our population is not taking a break because the coronavirus is in town. These things continue, so I really appreciate everything you're doing. I said this before, and I know it's going to be passed on to you, but I'm not sure if it was. There's a gentleman in my community that owns a nursing home. In fact, he owns quite a few nursing homes throughout various jurisdictions. And I called to ask him how things were going, what was the count and amount of the infected people, and if we as a county or the health department, if we were doing everything we could to assist him, or is there anything I could do to help? And he gave such a glowing praise of your department and the people that work for you. And he said and that's when he said, I'm going to let you know. And he ran down the list of various nursing homes he owned in other jurisdictions. And he said no one was more professional and more prepared and more helpful than the Baltimore County Health Department. He was so flattering. I said, do you know Dr. Gregory Branch? Because I'm sorry, Dr. Branch, I thought maybe he was a friend of yours. And much to my surprise, he said, no, he did not know you. But he certainly gave high marks for the support that he received from the health department of Baltimore County. And he thought that we were top notch above all the others. So I thank you for your presentation and all your hard work and efforts.
Thank you.
I thank you for your confidence. That's what we need now, people to be strong and confident. And we know that you're on the job, and it makes us all feel good. I had one question about the contact tracing. And I was happy to see that the community college is going to do the training to get people up to speed. But then I was curious, if we're going to train people, why is it necessary to have a AA degree to have that position?
So what happens is that it's more than just calling somebody and basically just saying some general information to them. The training portion of it is calling them. But remember, if I tell a person that you've been exposed to somebody who has COVID and now you've got to quarantine, there is a huge amount of case management now that has to go into preparing that person to be able to be quarantined. And so a person has got to have that type of education, experience, and ability to be able to case manage that person in addition to just calling them. So we do say that an AA degree is definitely recommended.
Okay, just to be clear, did you say recommended or a must?
Okay, so specifically on that, answer that question, I'm going to ask, is Della Leister on the phone? Can she hear me?
Yes, Dr. Branch, I can hear you. Can you
I
hear
don't
me?
remember what the specific was.
Okay, so Councilman Jones, we actually have 2 levels of contact tracers currently posted, and we're getting ready to advertise for a 3rd level. So a contact tracer 2 is a higher level because we expect them to be a team lead on a group of contact tracers. Contact tracer 1 will be doing the bulk of the calling. And then we also have decided to add community health workers to that. They will not have those advanced degrees. Those are the boots on the ground, people that know the community. And the whole goal is to try to reach individuals as soon as we know a positive lab. But some of the things that really need to understand are confidentiality. These individuals, we already have staff doing this. These people are very distressed to hear that they've been exposed to somebody. So there's a lot of mental health needs, a lot of community needs, as Dr. Branch said, social needs. So it really does take somebody that has good communication skills and can really help that person adjust to their next couple weeks in quarantine. So that's the different levels. We do have, the county does have the either or for some of our educational requirements, that if you have enough experience, it waives certain years of your education. Does that answer your question, Councilman Jones?
Yes, I believe, just to be clear, so there is a place for someone who do not have an 8A degree in that 3 levels?
Yes. Yes. Because we have an either or with some of our educational.
Okay, I thank you so much. The other thing is, I just want to tell you, Dr. Branch, we certainly appreciate the information on the Rite Aid, because that was one of the questions that I had that Councilwoman Bevins brought up, which is the need for a doctor to give you a referral to be tested. And I always felt like that was a significant reason why the counts that we're looking at, reported by ourselves in Baltimore County as well as the state, is so underreported, because there are so many people, and I know 3 or 4 personally, that have almost perfect symptoms that you would match up to the coronavirus, and their doctors were telling them to basically stay at home, call me if it gets worse. They're at home with their kids, and that's it. And they guess, thank God most of them have sort of come out of it or appear to be doing better, but it's the same story. If they have it and they are riding it out and their kids are asymptomatic, but I'm sure they probably have it. And so anyway, I thank you very much for that question, Kathy Bevins, and I thank you for your response, Dr. Branch.
So, Councilman and Councilwoman, what I would like to say is the fact that the Rite Aid is located at 5624 Baltimore National Pike. 5624 Baltimore National Pike.
Yes, thank you. One of our listeners, Corey Jones, looked that up real quick and sent it to us as well. Whose district is that in?
I believe that is Councilman Quirk's district. Should be Baltimore National Pike near Ingleside.
Okay.
Across the street from the Mr. G's.
That might be a good. Thank you, Councilman Branch. Councilman Jones, are you through with your questions for Dr. Branch?
Yes, I was. Thank you so much. And I guess the other part would be the other part of the comment section would be, I'm trying to look around for my checkbook, but I don't have a checkbook. The county has the checkbook. I want to say, Dr. Branch, what do you need? I mean, because there's no doubt about it. What you said was sobering. So many times, you're the health department, right? And now you're on the front line of our spear, and you're the defense for us in this pandemic. We always knew that we were susceptible to it. I've always been trained that it's possible to happen, and it was going to happen. You guys hope and prayed it didn't happen while you're around on this earth, but here we are. So thanks for all your efforts, Dr. Branch.
Thank you, sir.
Okay, next member who would like to have a question or a comment, Councilman Marks.
Thank you very much, Dr. Branch. Thank you for your leadership during this crisis and all good work of all who work for you. I just have 2 questions. First, the 21234 zip code is among the highest incidents of coronavirus in Baltimore County, and Councilwoman Bevins, Councilman Catch, and I all share that zip code. A lot of it is centered at the Genesis facility off Joppa Road. I've had some discussions with an executive from Genesis, but I really don't know the status of what's going on there. People in the neighborhood are concerned. I know they're moving patients into there and then taking negative residents to other facilities. Who is the contact person so that we, maybe the 3 of us or whoever, can find out exactly the status of what's going on at nursing homes like that? I mean, I know the governor put together this task force, but I don't know specifically what's going on at that facility.
I'm sorry, I was on mute.
That's all right. That's all right. Did you hear what I asked, Dr. Branch? Or
No, I could hear you. You
okay,
couldn't hear
I
me.
gotcha.
But if you want, we can talk about that because we are in contact with all of the nursing home facilities. So that if you
Okay.
have some specific questions, we can have a conversation about specific nursing home facilities.
Okay, who should I be talking to? You?
What you're doing, reach out to Kimmy, and then
Okay.
she will actually get you over to us.
And Kimmy's been outstanding, so thank you. The second question, going back to the opioid issue, and I want to commend this administration and you for the good work you're doing, certainly Mr. Bromwell as well. It's been a real sea change, I think, with this administration, and we appreciate that. The Daniel J. Torsch Foundation gets funding from us. It passes from the state to us. We're doing everything we can to accelerate the release of grant funding when we get that, aren't we?
Oh, yes, definitely.
Okay, because they had mentioned it took several months, and we finally got it through. I appreciate it, but anything we can do to accelerate that in the future would be appreciated.
Well, you know, there is a process that we have to go through in the county, and we start the process basically very immediately. But there is a process that happens to go through that.
Okay, very good.
Yeah.
Back to my first question. So I'll be in contact with Kimmy. Again, she has been great to work with, and thank you to all your staff.
Thank you.
Thank you, David. Councilman Quirk had his hand up next.
Thank you, Madam Chair. Dr. Branch, as you've heard from the council, clearly we appreciate your work and obviously all the nurses and doctors and medical and health people and a lot of good work happening out there for sure. And a couple of things, I guess. One is, you know, when just statistically looking at the overall fatality rate, it seems just like we've been talking a little bit about already. If we back out, you know, the comorbidity, you know, nursing homes, obesity, type 2 diabetes, also seems to be something with, I mean, from everything we're all reading about coronavirus, which I think is the only thing we all read about anymore, vitamin D deficiency, perhaps. It seems like when you isolate some of these populations, that the overall fatality rate might be lower than kind of what we're reading. I mean, it's still tragically terrible, and this virus is no joke, but it does seem like there's a certain small percentage of the population that this is really, really, really serious. So I don't know if you had any updated projections or analysis on that. And then in addition, obviously, like there's a lot of talk about antibody tests and, you know, antivirals and it seems like we got a lot of, obviously, science, so much science on this, it's really hard to track the number of antivirals that are being tested right now. So those are a couple just kind of open-ended questions. And then a few thoughts too. Seems like ventilators are really not the answer. I mean, it just seems like a lot of the people that do need ventilators, and it's not just anecdotal, it's really some of the findings we're finding out there that it's a pretty bad place to be for sure. And then lastly, you know, any thoughts on, you know, reopening and then does the county have a plan, or are we just deferring to the state on how do we reopen in the most reasonable and responsible way, but try to get things back and running again? So I know that's probably 7 different things in one statement. But
Okay. So let me see if I can help out here and pull some of this stuff together. The coronavirus is a new virus, and because it's a new virus, we don't know exactly what it can actually do. So we're learning that as time goes on. So there's a lot of things that's actually happening. So what we do know is that if a person has chronic diseases like diabetes, hypertension, heart disease, we know that those people are going to do worse. And that's what we see. Those people are doing worse. The reason why African Americans are doing worse is because African Americans have many of those chronic diseases. The reason why the nursing homes are doing worse is because the people in the nursing home have those diseases. You then mentioned what I'm going to lump into research. There's a lot of research going on as it relates to vaccines, as it relates to medications. And so at this particular time, this is what happens always. What happens now is because we have social media and we've got 24-hour news, you guys are hearing about all these very early stage research grants and projects. Usually the public wouldn't know about a lot of that stuff at all. And by the time you would know about it, it would have already passed the muster. At this particular time, just because one person is doing a research project on a particular drug does not mean that drug is going to be good for us. And what we've seen at this point now is there is no drugs at this point now that we should really be giving somebody when it comes to COVID. As it relates to ventilators, ventilators is not a preventative thing. Ventilators is obviously a part of the treatment. So that if a person has COVID, and I will personally tell you, my cousin who was 30 years old has asthma, and he succumbed to COVID-19, and it was on a ventilator for 3 weeks. But he got better, and now is off, and that's the beauty of the ventilator. It was able to support him for that 3 weeks. If the ventilator was not there, he would have died. As it relates to the reopening, what we do is the fact that we definitely look at what the state is doing. However, we in the county are obviously looking at what the plan will be to reopen. Much of the plan is based on what the COVID virus does. And so at this particular time, we know that the numbers are all still going up. We haven't plateaued and we're not coming down. People are getting a little antsy now, so they're trying to push at this point now to open up the social distancing. But in fact, those numbers are still going up. So we in the county are looking at those very, very closely, and we will obviously act accordingly.
Councilman Quirk, do you have any other questions?
Nope. I do appreciate it. I mean, we've all been looking at the possible curves. I just read a scientific analysis where the number of different possibilities between now and the fall are literally nothing happens. It fades out when it gets hot in the summer to like we get a resurgence in the fall that's significantly worse than what we've already seen. So I feel like even the top scientists in the country, I think you might as well say we have no idea, because I've read just about anything I can consume on this, and the range of outcomes, it feels like everybody's sort of guessing, so I guess we'll all find out, but it's certainly hard to try to understand this one.
Exactly, Councilman. This is a new virus. It's brand new. We don't know what's going to happen. And we continue to practice medicine. We're just practicing.
Mr. Quirk, if you remember when Tom Hanks and his wife came down with the virus and they both tested positive, they were in Australia, and it was Australia's summer there, and it was 100 degrees and had been that hot for weeks. So necessarily, I don't know if the heat, the heat coming through is going to do anything about it, if you want to use Australia as an example. Are there any other members that have any questions or comments?
Yes.
Councilman Katch?
Yes, Dr. Branch, I want to thank you for all the great work you've done and all of the people in your agency. We really appreciate it. Uh, I'm curious in regard to nursing homes. I know that the state of Maryland inspects nursing homes, and I know that Baltimore County inspects nursing homes as well. And I really have two questions or 2 points. I'm just wondering if there's any changes in the law in Baltimore County regarding nursing homes that would be beneficial should something like this happen again. And secondly, if you had to name the three biggest causes, largest causes of nursing homes being hotbeds for corona, what would you say they are?
Okay, so let me just say to you that the state licenses the nursing homes, and they're managed by private entities. So we, as the local health department, don't have any real oversight over a nursing home, except if they get a food permit, and we are dealing with them from that perspective. But clinically, we have no oversight over the management of those. I say that to you to say that there's a lot of issues with nursing homes. And so, because of this pandemic, I had to, as the health officer, jump in and give guidance. And I had to give them some health officer notices that tell them what I think they need to do in order to stop the spread of COVID, because I couldn't stand by and let it continue on. So if there's going to be any changes in anything, I would hope that the state would understand and provide the resources so that the local departments of health could actually have more of an oversight management of a nursing home, because right now we don't have that. If I had to give you the top causes of why nursing homes are a hotbed for COVID, the one major thing is that it's congregate care. Anytime you have congregate care, it's going to be an issue. And then the other thing is because they now all have the chronic diseases. Because of congregate care, the chronic diseases, and then on top of that, they have a lot of staff coming in and out, right? So what we've realized is that a lot of staff from nursing homes share the same staff. So that I could be a nurse working at 3 different nursing homes in the county. So you're going from nursing home to nursing home to nursing home. And that's more likely to happen, believe it or not, with the physician, the medical director. So I'll say this to you because Baltimore County was the first to do this in the state. And I think we did a great job with this. I mentioned to you that congregate care was a very prerequisite for people with COVID. And we know that our shelters have congregate care. So before COVID really hit, in Baltimore County, we removed all of the homeless people in our congregate care shelters who were at high risk for COVID, and we put them in hotels around the county. And we only left the people who were not high risk, the young children and the healthy adults. They were able to then social distance from one another while they were in congregate care. And the people who were older with chronic diseases were in the hotels, and they were separated by their rooms. I'm knocking on wood right now, but I can tell you that you have not heard about our shelters having COVID-19 in them, because in Baltimore County they have not just yet. And so that was because of the staff that I had, we were forward-thinking in being able to do this and to protect that particular group of people. So I think that Baltimore County has major kudos when it comes to congregate care of the homeless population as it relates to COVID-19.
Dr. Branch, I thank you for that and our forward thinking. In January, when the Maryland legislature convenes again, I would hope that you would work with the county's liaison to the legislature to take a look at current state law and staffing, et cetera, so that we're not in this position again. I can tell you from someone who was on the Health and Government Operations Committee for many years, the issue of nursing homes and inspections has always been a problem. And I think that with the experience that we've had and that you've had, I think that you are a great resource for the state to give the legislature some idea and the administration in Annapolis of what we need to do to strengthen our nursing homes, because unfortunately they're not shrinking in population, they're growing in population, as our senior population in the county, I think, has now hit 200,000. So thank you very much, and I hope that you'll play a major role in this issue during the upcoming session. Thank you.
All right.
Thank you, Councilman Catch. Councilman Batoka, did you have a question?
Yes, thank you, Madam Chair. Dr. Branch, thank you for the presentation. I was wondering if you could describe the programs and units that are moving from the Department of Planning over to the Health Department and the benefit of that.
Is Terry on the phone?
This is Mark. I think Terry had to step up.
Dr. Branch, he had jumped into another call, but I'll text him and have him come back. If Councilmember Patoka could hold that question, we'll get him right back.
I think
on the phone.
I hadn't jumped off yet, Stacy. I was just about to for that presentation.
Okay.
I missed the question.
I was asking Terry if you could describe the programs and the benefit that are moving from the Department of Planning over to the Health Department.
Sure. So what's going to be moving over is within the Neighborhood Improvement Division, it's going to be the planning section of that, which would be the CDBG funding, the continuum of care, homeless services, related outreach services, and all the efforts related to the VCA. Other than housing finance, that division is staying at planning.
I totally understand moving the homelessness program to the Health Department. I was a little puzzled at moving block grant and the administration of that to the Health Department, because traditionally health departments aren't community development organizations, where planning departments are more traditional community development organizations.
Understood. And I think this is something that Stacy probably has some thoughts on as well. But in the work we've been doing on the VCA, it's one thing to think about this as moving to the Health Department, but what we've been doing is creating an entirely organized health or housing and community development unit within HHS. that's going to combine both aspects of housing and the voucher program, how that ties to housing stability amongst our most vulnerable, and also looking at efficiencies around how we communicate to the developer community and look at working together to build that those housing resources. And so what we'd be doing with under the HHS umbrella is functioning much more like what you would see in other counties with a housing and community development function, with all of us working more closely together. And I can tell you that after presenting this, and I'm happy to have a longer conversation with any of you, after presenting this to HUD and presenting this to the housing advocates, this made them very excited and happy for how we plan to move forward.
So if, let's say a community development plan is going to be initiated for any of the areas in our district, that would be done through the planning department, not through the health department. Is that correct?
That's my understanding about where that would initiate, and then we would be there to help develop some of the resources around that plan.
Okay, so it would be kind of I think they used to have, I don't know if they still have this, they used to have sector teams at one time in Baltimore County, where different agencies that were focusing on a specific sector, and I think it was more geared towards inner Beltway neighborhoods, which is something to think about. But I just wanted to understand that. I'd like to, a year from now, when hopefully we're in a budget that where COVID-19 doesn't dominate the discussion, that we could see how this is all working out and see if it's the appropriate place for it.
That's a great conversation.
Councilmember Patoka, I would echo Terry's description of this. It's our goal to create a vision for affordable housing. One of the challenges that was presented to me last summer was our ongoing challenge of interconnectivity and the business process relationship between the three entities that have some pieces associated to the VCA. HUD was very clear that our structure was problematic. So we have support from HUD. I'm very pleased that once we all came to the table, we have support from HUD in terms of technical assistance. We're dealing with working with the Enterprise Foundation National Resource, and some of the examples and benchmarking that we're using in terms of how our configuration, how we're doing this, is being informed by those discussions. We weren't in a great place last year with HUD when we began working on this, but I'm pleased to say in a year's time, I feel that we've developed an excellent working relationship. HUD sees that we're serious, and I think that the advocates have described the direction that we're moving, that they are cautiously optimistic that we're doing the right thing. But we're happy to continue to provide you updates on the model. We're doing some more work with the Enterprise Foundation, and happy to keep you apprised of that.
Councilman Patoka, this is Dr. Branch. I just wanted to do a very simple clarification, if I may. It's the Department of Health and Human Services, which consists of the Department of Health, the Department of Social Services, and the Office of Housing and Community Development. So the Office of Housing and Community Development is not under the Department of Health. It's three different entities within the Department of Health and Human Services. Are you talking to me, Cal?
No, Izzy, he's talking and but he's Izzy, you're muted.
Sorry, somebody put me on mute. I didn't put myself on mute.
Oh, that's what everybody says.
What was a little confusing is that in many jurisdictions, Housing and Community Development is a standalone agency. And that's why I was a little confused as to how it all fit together.
Correct.
Let me just also make one final point. I want to give a shout out to a member of your staff. He might actually, it looks like he's on right now. Mark Millspaw is doing an outstanding job. And I just want to say that publicly.
That's great.
Madam Chair, and thank you, Dr. Branch and Terry and Stacy.
Thank you, Councilman.
Thank you, Councilman. Next, we have Councilman Quirk, and we're really starting to run over for our next hearing. I just want to remind everybody. So we probably won't take a break. Councilman Quirk? Councilman Crandall?
Thank you, Chairwoman. I will do my best to be brief. I think that the council members and Dr. Branch and his staff have done a good job in getting our questions out there. So I don't have too much, but I did want to thank Dr. Branch and his agency for all of the work that they did not know that they would be doing as of 2 to 4 months ago. So, and it's a very fast-paced thing that's happening in a lot of agencies, but especially in the Department of Health. Dr. Branch, I was very thankful that the county launched their own COVID case dashboard, and I've been posting on my own Facebook account since I believe April 13th, zip codes in my district and what the positive case counts are. So I wanted to thank you for it. And then I also wanted to ask you, or maybe you can answer offline, or maybe IT can, where we discovered discrepancies in the county website as opposed to the state. So for instance, I looked at a zip code yesterday in my district, and the number was within maybe 7 cases. Everything else jived. It looks like everything was updated. Both sites were updated, but one was slightly lower. And then a couple days ago, we had 3,000 on May 4th. We had 3,448 positives. On May 5th, both the state and the county website concurred that number had actually gone down to 3,430, which is not possible considering these numbers are cumulative unless there's some other revision going on. So can you speak into the discrepancies between maybe the county website and the state website, and how we would inform our constituents on these potential discrepancies?
Yes, I may, sir. So one of the things that happens, you got to look at the fine print on the bottom of the pages, because it will tell you when they update their website. So depending on when they update, you'll make it a slightly different number. As it relates to numbers going down, that happens because when the state aggregates all their data each day, they basically say, okay, you have this many cases. And then when we go through it with a fine-tooth comb, we say to you, 40 or 50 of these are not Baltimore County. They're actually different jurisdictions. Because remember, we share zip codes.
Yeah.
So when we actually look at it, it's sometimes the different zip code. And I'm quite sure other people in different zip codes are saying to us, that's a Baltimore County case. So they can give us a number at 10 o'clock in the morning, but by 3 o'clock that evening, the number has gone down. By the time it comes to the next day, it's gone back up again. So therefore, it's a very, very dynamic number. And you should look at the number as a general number and not as a specific, it's going to be, to the number, because that's going to change within the next minute.
Yeah. Okay. Well, and that's a very good explanation, and confirms some assumptions that I had based on simple updating of 2 different data sets, and one being reviewed by the author of the other data set. So that makes sense. And just from an interesting point that I found, and to your point about sharing zip codes, 21224, which is the Colgate Eastwood area of Dundalk, is a small zip code in the county. However, it includes all of Canton and Fells Point and Highlandtown. So it's a very, I'm sorry, Kathy?
And Berkshire, part of Berkshire.
And Berkshire's in there too as well, right? And parts of the other side of Eastern Avenue too, Graceland Park and forget the other one. They're going to kill me for forgetting the name. Harborview, right? So in that one zip code, there are, as of yesterday, 386 cases. It was reported yesterday by the county portion only, 206 cases. Now that should be fairly alarming because 206 cases and a very small portion of that zip code seems to be a high density for those for positives to come up in such a number there, which is why I'm thankful that the Dundalk Health Center is a testing site, which is a step in the right direction. But I said I would be brief, and as usual, I'm not. But Dr. Branch, thank you for the explanation and for all the work that you and your agency are doing. Thank you.
You're most welcome.
Thank you, Councilman. I think that wraps it up. All the council members have been heard. All right. Dr. Branch, thank you so much, and thank your staff on our behalf. And you stay well and keep up the good work. And we'll remind everybody to keep washing their hands, wearing their masks.
All right. Thank you.
Away.
Bye-bye.
Bye-bye. Okay, we're going right on to our next budget hearing. We're in the same meeting, unless anybody needs a break. Should we just continue? Is everybody okay with continuing? Okay, alrighty. Next, we have the Department of Economic and Workforce Development. Our director, of course, Will Anderson. The budget office analyst is Rich Sturba, and our legislative analyst is Abigail Matthew. So Abigail, the floor is yours.
Thank you, Madam Chair. The proposed FY 2021 budget for the Department of Economic and Workforce Development totals $19 million, a decrease of approximately $1.9 million, or 9.1% from the fiscal year 2020 budget. The general fund portion of the budget increases by approximately $163,000, or 10.9%, primarily due to the addition of a new workforce development program, as well as personnel costs. The special fund portion of the budget decreases by approximately $2.1 million, or 10.6%, due to a decrease in PAYGO funding to the Economic Development Revolving Financing Fund. This analysis identifies 5 potential operating budget reductions ranging from $100,000 to $385,000. In your packet, you will see that each potential reduction is identified as either a normal economy or pandemic economy reduction. The first reduction shown, labeled normal economy on page 5, is a type of reduction our office would be likely to identify under normal economic situations. It relates to the department's spending history and history of expansion. This reduction may be worthy of discussion because it relates to consulting services through the new Workforce Development Program. The remaining reductions, beginning on page 5, relate to the new pandemic economy that we have entered. These explore how across-the-board actions might affect the Department of Economic and Workforce Development, and the purpose of presenting them is to give the director an opportunity to discuss the operational impacts of large-scale funding changes so that the possible staffing and service level effects of lost revenues can be understood by all. Other discussion issues follow in the budget package, beginning on page 6, where we first identify the department's response to COVID-19 and discuss the revolving financing fund and tourism program. Other discussion issues include workforce development, general fund, and grant programs, organizational grants, the anchor strategy and incubators, and TradePoint Atlantic. At this time, I would like to turn it over for discussion.
Thank you so much. Do any of the members have any questions or comments for Ms. Matthew before we invite the director? No? Okay, Mr. Anderson, are you with us?
I am. Can you hear me, Madam Chair?
Yes, good afternoon. How are you?
Good afternoon. I'm doing well.
Okay, good to see you. The floor is yours, sir.
Thank you. I appreciate the following up with Dr. Branch. I know the detail that you needed to go into is hard and exhausting. So thank you for jumping into our department. Thanks, Abigail, for her report to you, Madam Chair. And as we jump in, I'd like to acknowledge the shifting landscape that COVID-19 has caused. The county's revenue is affected, and our business revenues is affected. Our workers' income is affected. So all of our sources of funding for things like hotel tax, they're gonna suffer, and they're gonna suffer immensely and for a while. So these are pieces that need to be brought in. Our budget request was prepared with long-term strategic thinking, things that have been a part of the county executive's focal point since before he took office, and his transition report turned into his enterprise strategic wide report. So we're talking here about what we've been planning, and we know we're going to be shifting these things relative to COVID, and I know your questions will be oriented that way. I'd really like to thank on our team, Susan Gehring-Leiker and Angelique Finnis Newport for navigating this, because they're doing real-time taking care of the total incoming that's coming from business and workers alike, and helping us prepare this budget with you. I have both of them on the call if I'm making missteps. So thank you. As I said, the way we approach this, I'd like to just talk about the new charge.
Sure.
We looked at the strategic plan as it was developed. County executive have 6 goals. 5 of them really apply to our work. The goal of vibrant communities ties directly to tourism and economic development. The goal of educational excellence and lifelong learning is workforce development. Goal 3 of equitable decision making is about our Small Business Resource Center and economic development and inclusion. And you'll see it when I talk about our grant program, where we're focused there. Goal 5 about government accountability is about performance management across all these divisions. And goal 6 about workforce empowerment really ties to what we're doing in workforce development, including our youth services. Now, obviously, COVID changed our approach. We are quickly implementing new strategies while we're in the middle of, frankly, we are still in response mode for a number of our businesses. And I want to share some data with you on the workforce side. Things are unfolding, but I have to thank our Office of IT, Rob O'Connor's team, for what they've done. They've helped turn us into a remote operation and a call center for a lot of people in panic. While Dr. Branch is dealing with people in a health crisis, we're dealing with people in an economic crisis that you all know is real. We've been working with each and every one of you as council people and your staff, and taking in the heartbreaking needs that are coming right through your constituents into our team. But Rob's team has helped us build these systems that are allowing us to do the response. We really appreciate that. With that, I'd like to just I'll just cut right through our 3 different business units. We have economic development, tourism, and workforce development. In economic development, our O52, as you heard, our the overall budget, excuse me, is a decrease because we didn't ask for $2 million more in our economic development fund. So that's why you saw a reduction there. And on the operating side, you see a slight 2% increase to scheduled salaries. The one item that looks a little odd might be our Boost program, which is the fund that we used from previous gambling money. There was a pretty significant decrease in what we've budgeted, and that's simply because last year we took a number of years of monies that were available to us and we hadn't captured yet. So it was kind of an inflated number last year, and this year the 180,000 is a little bit lighter. But a couple of highlights I wanted to point out of what's been going on in economic development. We stood up, if you look at the strategic plan, we've hit a lot of the county executives' major initiatives. We stood up the Economic Development Advisory Board, which has been instrumental here in COVID because the county executive has been coordinating with that board and all the companies that it represents and industries it represents. We initiated an anchor strategy. We added new staff. We added consulting contracts to really focus on our anchor strategies. I'll talk more about why that's important in a COVID or a recession space. We've added a business development rep on our west side to focus on the west side of the county. We've implemented new outreach strategies. Of course, we're doing a lot more with TradePoint Atlantic. We're We're trying to help bring in a second major grant for them on their port with the federal government, and we're feeling very optimistic about that. And we've been implementing a number of brand new programs that we've designed, built, and are about ready to launch relative to COVID with the CARES funding. So as we move into FY21, we're going to be doing all of our standard business activities in economic development, but it's really going to be a focus on economic recovery. In tourism, you see a slight decrease there because several of the grants that were going to city-based organizations have matured and expired. That's about $500,000 worth of that. That's why you see the budget is slightly less. I'm really excited by what we were able to get done in FY20, and this maps to what the county executive committed to do in tourism. And I know, Madam Chair, you and others have been pushing the administration for years to get active in tourism, and this county executive is doing it. We hired a new senior manager in Daniel Singh, who most of you have met. We've been executing our arts and sciences grant process that we took over from the administration of Rec and Parks. We're in the process of procuring those arts and sciences project grants now. We've secured the first arts and entertainment district in Catonsville. We initiated the new celebration grant program, which we had to postpone as soon as COVID hit, but we are going to reinitiate that program. We continue to expand Restaurant Week, and we actually have some unique ideas for Restaurant Week coming out of COVID. You'll see two big things that follow the tourism ROI study that we did about 18 months ago. One is the key visitor experience, and two is the feasibility study with Johnson Consulting. And we talked at length as we brought that contract to council recently. And now we're implementing COVID individual artist emergency grants as a part of our two-pronged approach that we're going to be taking out to the field. When you look at what's happening in FY21, we have two new positions, both of which are funded from within existing budgets and grants, and will help us continue to add to a professional team and grow to what that report showed is out there. You'll remember that report showed there's a $10 billion industry in Baltimore County over the next decade. It's not just about quality of life. This is about real dollars, and that's pre-COVID. But what you're looking at now is post-COVID. We're making a big shift in the tourism industry. I'll point out a couple of staggering numbers about where we're headed in tourism. If the tourism industry looked at what international travel looked like, in 2018, 1.4 billion people traveled internationally. When other major shocks to the system hit, like 9/11, when 9/11 hit, it took 3 years for the world to begin traveling again at that same level. And then when the recession hit in 2008, it took 2 years for the world to return to that level of travel. COVID, some of the projections are that it's going to take 5 years for the world to begin traveling at the level we did last year. So what does that mean for us here in Baltimore County or even globally? 10% of all the world's workforce is involved in tourism around the world. So just economically, it is vital that tourism get rebooted around the world. Road trips are going to be a major new focal point. And for a place like Baltimore County, that's actually very good news. We are in close proximity to millions and millions of people whom we've not been actively marketing our assets to. And from the water to craft to horse country to you name it. So one of the initiatives that we have going on at the state level, the state is asking all of the local tourism groups to be open ready. You know, as we start to open up and come out, what are the initiatives that we can promote together and have people who are certainly restless and people who certainly have money to spend and are going to want to do things in the arts, culture, and tourism. How do we activate that easily for them? So we're in that process, even while we're kind of trying to deal with our tourism and tourism-related industries that are taking such a hit. We know that one of the things that is a big thing for the county is where does the hotel tourism tax come from? Where does it go in COVID? When those projections are hotel revenues going down by 50 or 75%, we know our receipts are going to go in the same direction. So anything we can do to help that industry actually comes back to us in hard dollars. On workforce, I wanted to point out lastly that we've never had a county appropriation for workforce. And we have a $100,000 appropriation in this budget. Now, why do we have that? We have that as leverage money, and that's how I think people should look at it. We know if you just ignore what's going on with COVID, we know that there are many, many grants we could be chasing, $1 million grants that we could be chasing with partners to bring in dollars into this county. When we don't have any staff that is free of another grant to go after these resources, we can't do it. And you've seen us do this in the past with, think about when RG Steel went out. And so 2012, we got a national emergency grant to help those people. We're in that kind of mode right now. There is a lot of money that's going to be floating, coming for skills training, for all kinds of job placement training. We need to go get that money. And that means that's work to go get it, but it's out there. The contact tracing that you were discussing with Dr. Branch, so our team is part of getting the money to train those people. And it's difficult if we don't have people who are not involved in a grant. That's what this money does. It's money that turns workforce into other activities, and it lets us expand our work in places like the library and CCPC. So it's actually a great leveraging dollar. One of the big things you're going to hear people, the new acronym you're going to hear people talking about is, I don't know how they'll pronounce it, but RAWA, Relaunching America's Workforce Act. Many of you will remember back during the recession, the ARRA, ARRA, 10 years ago, that was about a $1.2 billion investment for dislocated workers. It's going to be double that this time. So if there's $2.5 billion coming in under RAWA for dislocated workers, we need to be ready to go get it and maximize it. And this appropriation in workforce helps get us there. And then lastly on workforce, I just wanted to point out some good news because we're working with you all so directly. It's weird to say this, but good news. We tripled the number of people joining unemployment last week. Now, I can't believe I'm saying that, but that's actually what we desperately need and your constituents have been asking for. So 17,400 people joined unemployment last week just in Baltimore County. 100,000 in Maryland joined. So Maryland has almost 500,000 people on unemployment. We have over 79,000. Now we have 420,000 people in our workforce, but 79,000 is still an enormous number. And each week, our team is trying to counsel and deal with close to 1,000 people with our little staff to help them first get into unemployment, which we have very little ability to do, but secondly, move into job training for a new economy that's going to be out there. And they've been doing an amazing job. Two resources I want to point out. One other thing is for all of you who have independents and sole proprietors and gig workers that have been locked out of unemployment, and everybody has them in their jurisdiction. Almost half of last week's applicants were in that new class of people, which is finally good news for all these people who've been locked out. 47,000 people across the state that were independent gig workers now are inside unemployment. And a reminder, that's mdunemployment.com. But the other thing I wanted to point out to you is if you go to our website at baltimorecountymd.com/job board, that's where you're going to find all of the jobs that we are actually still hiring for. So that's the final thing on the workforce, and then I'll just dig in a little bit on business development. Some data. In a typical month, our team will handle maybe 1 or 2 rapid response events. That's like GM is closing, and we've got to get there, and we've got to help those people before they all just go back to sitting on their couch and figuring out what's next, because we can help them. This month, we had 11 major employers close, and our rapid response team heading out there. We had 132 individual businesses that we've been counseling, trying to help them figure out where they are in the essential status, trying to help them in PPP, trying to help them navigate a very shifty landscape. And here's an example. For those of you who have the people who've gotten their PPP loans, many of the larger businesses are considering giving them back. And the SBA just changed their rules today to give people one more week until May 14th to give them back if they really didn't qualify. That's a very shifty landscape to try to get financial decisions made. And then while I was waiting on this call, the U.S. Department of Commerce announced a $1.5 billion EDA grant that is targeted to economic development. It is targeted to planning, preparing, responding to these kind of crises. It's a little late in coming, but I'm glad it opened today. So it's a piece that the county is going after. And it's going after it in the context of the county executive's new committees that he's structured. So the Business Recovery Committee that is being headed by Deputy Administrative Officer Drew Vetter has initiated our loan deferral, is going after this grant. And come Monday, we're going to be launching these two major programs that our teams are furiously building. One is the $10 million Small Business Emergency Relief Grant, and one is the Individual Artist Grant. And thank you to the legislature. We talked about this earlier in the week for the bill you're moving forward to help us speed this thing up. I'm feeling really good about, we're going to get 650 grants out to small businesses in the increment of up to 15,000, and individual artists, we're going to get up to $1,000 quick grants in the hands of folks who are really suffering. So we're excited to launch these programs and get them out the door. People that have been excluded because of the criteria, I understand that people are having a tough time with it. It doesn't meet the needs of everybody under the sun. Unfortunately, at a local level, there's only so much we can do. And we've had to stop taking inquiries into, we can't advise people on a grant that we ourselves are administering. But the surveys show that 97% of our businesses have an impact of COVID, and 70% of them have had to do layoffs. And this represents, just from our survey, about 12,000 employees, companies that have about 12,000 employees. 2/3 of them need money. So what's going to happen next week is the county executive is focused on the very small companies that have employees that didn't get any benefit from any of the relief programs that have rolled out from the state or the feds. They've been shut out. So we designed this program to meet his goal of get this money to as many people as quickly as possible with no mistakes, and get that dollars in their hands and try to help them save their employees. And that's what we're going to do. So you'll see this committee, though, under Drew Vetter, moving toward reopening focus, mapping to what's happening at the state level, mapping to what can the county do to help smooth whatever these incremental stages look like for restaurant openings and retail openings and other business openings. There's a role to play for the county to help make it possible and still be safe. There's a balance there. I know there's some people who want just open and some people who just want closed, but there's a balance there. And you're going to see this group under Drew focus across a wide spectrum of what can we do and where can we be creative to help make it happen, but make it happen safely. So I think that was everything I wanted to cover. I'm happy to answer questions, Madam Chair. Thanks for giving me a few minutes to just riff on this.
Sure, Mr. Anderson. Thank you for that very, I'm going to call it sobering update on business closures in Baltimore County. And I know your agency must be overwhelmed right now hearing from both small and large business owners in the county. Could you tell me, do you know how many people have actually applied, if they've applied already for the $10 million grant that's available?
Yes, we will open applications on Monday morning at 9 a.m. So no applications have been received yet. And we're going to open for the individual artist grant at the same time.
Okay, I thought that got moved up for some reason. Okay, I'm sorry, that's good to know.
Testing of the system got moved up because OIT delivered our system early. No, we're making sure that we're ready to go. So, and we've been giving guidance online, so you may have seen some new guidance. so that people can get ready. It's a very simplified process, but we wanted people to have all of their stuff in a pile and ready to go so that people weren't making mistakes.
Yeah, that's what we've been encouraging people. Please get ready if you're ready to apply and be there first thing so you can take advantage of this. I'm sure all of my colleagues have been talking to so many businesses that don't even know if they'll be able to reopen and don't even know if the 15,000 will make a difference for them and will come in time. So it's just a very challenging time. I don't have to tell you that. You're living and breathing it every single day. So I'd like to talk a little bit about COVID, not just affecting businesses and jobs, but our healthcare system as well across the whole county. We do know that they're a jobs driver for us in Baltimore County. For instance, MedStar Franklin Square in my district, I believe, is the second largest employer in Baltimore County. They have about 3,200 employees, and they're right next to the campus of CCBC. So we have a lot of people working out there, a lot of folks that I've been worried about during this COVID. But it's very important that we talk about the importance of our healthcare systems across the county for jobs driver. I'd also like to mention how important I believe some of these new titles that have been given in the Economic Development Department over the last year and a half or so, the anchor strategy. I know that that's very critical now in higher education system to keep us competitive. If you want to talk a little bit about that.
Yeah, I mean, we didn't anticipate COVID, but so Chris McCollum joined the team to run the anchor work. And when Chris and I were looking at economically, what do anchors, why do they matter? We were looking at research about anchors like research parks, universities, and hospitals, and how much better they fare in a recession than any other industry. Now, we didn't anticipate this kind of recession, but we know we have these great assets that if we can take better advantage of helping them grow and connect our own small business network to them, the supply chain, everybody becomes more resilient because the nature of an anchor is it can take these shifts far better than an industry that is really tied to just one vertical. So anchors were huge. We got a contractor looking at and starting the study on that. We've shifted our work on anchors to look at COVID-related work on anchors. So that's been a major effort. But you're right, healthcare is our number one industry, and healthcare is gonna look a little different coming out of this. So retraining people is a key thing. If you go to our jobs board right now, where we have dozens and dozens of companies that we're helping to hire right now during COVID, healthcare is among them, and besides the contact tracing. So it'll be there coming out of this, but particularly knowing the age of our county and that we are an aging county, healthcare is going to continue to be a massive need, and places are innovating. GBMC and other places are innovating with technology. Towson University now graduates more healthcare people than they do education, and we already know that they are a provider on the education side. So these are initiatives that were huge for us. And we know they're going to pay off in the long run, not just now during COVID.
Thank you. I have one other comment. I'd like to talk a little bit about tourism, which falls under your agency. Yep. And I'd like to thank the administration and yourself for taking tourism seriously and finally have some decent funding for tourism and hiring a new, I don't have his name in front of me right now.
Daniel Singh. Yep.
Yeah. So it's an exciting time for Baltimore County as far as tourism once we open back up. I know there's been many people involved over the years in making sure that happens. We have a board of dedicated people who have done nothing but try to encourage tourism in Baltimore County, not just our wine count, not just the wine and the horse country, but our waterfront communities. Baltimore County just has so much to offer. I would like to talk a little bit about the study that was done. Well, there's no sense really going back to that study because it's done, but it was $75,000, and I know noticed more funding going out, and I'm excited about that. I'm excited about the funding, but I'm just going to say I don't know how excited I am about the same company getting the contract, because I was very disappointed in the first study, how so much of the waterfront for both the 6th and 7th district was not mentioned. And we all know that the waterfront is a huge economic driver on the east side of Baltimore County. 40% of the people that use our slips and dock their boats are from Pennsylvania and out of Baltimore County from other jurisdictions. So we know that there is a need for that to be mentioned, and the restaurants that work so hard that only get 4 months out of the year really to make their entire year. So I don't know if you want to speak to that now, but I just was curious why the same company was sought out.
Yeah, if I can speak to it, because I think there was, I think some of the concern was pent up how long the county had really not focused on tourism. And we were not going to fix that in our first attempt. We didn't, but I think we hit our goals, and our goals were to show this county this is a place we need to invest in. We've had people on that commission, yourself and others, pointing out we need to invest. Well, this was an ROI study that shows if you invest, it makes good sense in the county. That was the goal. The goal of that project was not to develop a comprehensive tourism strategy. I know there was a draft release of that report that got out, and the marine trades folks thought they weren't included, but as I showed them all, they were included in the final document. They were looking at a document that only had half of their data in it. But the final report had everybody in there, and it showed the importance of our waterfront, and it led to a new program. So we launched a new marine loan program to help our marinas and maritime businesses make improvements, and we're having loans flow through, and it's a result of that. It's so maybe a little bit of baby steps, Madam Chair, but we are catching up to you on why was Johnson awarded more work here. Actually, this is their sweet spot. I mean, they came in because they know this work and we could go really fast. But they do a couple of big things. They know how to piece together big, complicated, expensive initiatives. They've done it around the country. They're doing the Capital One, $1 billion program down in Northern Virginia about serious tourism, hotels, conferences, tying big initiatives together. And that's what our county executive wants to see what's possible here. But the key activities is building out on every piece of the pieces that we identified in that first study. So I'm really optimistic that we can do it. I mean, we've started the work remotely, but we have a lot of plans to do a deeper dive and build packages, build true destination marketing efforts. And that's why you've seen us add people to the team and add budgets that we can actually get behind and do initiatives, go out and bring people into this county, because we know it's going to pay back. So I appreciate your patience. I know you want us moving as fast as we can. So do we. I think we're making good progress, and I'm excited that we're going to be regrouping at a great time where we have an undersold set of assets, and we have a lot of people who are going to want to get out and do things. This is a great time for us to help them find their way into the county, rather than getting on a plane and going to California, because they're not going to be doing that.
Right. Yeah. Right. Well, I'm glad you feel optimistic. So I'll be optimistic right there with you.
Okay.
Okay. I think I'm finished for now. I believe Mr. Councilman Crandall had his hand up first. Councilman Crandall.
Thank you, Madam Chair. I'm in full springtime mode, so I'm not going to go on camera.
I don't want to know what that means, but okay.
Neither does anyone else, believe me. All right, half springtime mode, not full.
Okay.
So and Councilwoman Bevins, I think, brought up a good point with going back to Johnson Consulting for the second phase of the consulting contract. I know that she and I talked and shared some concerns because of the general disappointment that we had in the first go round Some of it was, as you mentioned, Will, was miscommunication, a document released that wasn't quite ready for prime time. And I think some of it too was given the council's pretty much unanimous passion for investment in tourism. I think our expectation of that deliverable was maybe different from what you and your agency was expecting from the consultant. And we voted for that second phase of the contract, I think, to put our trust in you, as we always have, to rely on the right people to do these things for us. And I also know how consultants work. I think from Johnson's perspective, I haven't reached out to them, and these are my words, not theirs. Every consultant new to an entity, whether it be a corporation or a municipality, has to go through a discovery phase where they get the lay of the land. And I think a lot of that first phase was their discovery of what are the assets and what's definable within Baltimore County. And my hope now is they can place numbers and give us guidance as to the appropriate investments that could be made. And I think you've already stated that. So we're really looking forward to that and getting out of every day all things COVID and getting back to some sense of normalcy here. I do appreciate the amount of work and effort. I texted you at 9 o'clock last night. I expect a thank you from you for taking you off the hook for not having to answer me.
I saw it in the morning, and I saw both of your I'm sorry I didn't get to your.
No, you didn't need to. I was able to answer my own question.
I was in family time at 9 o'clock. You just missed me.
Well, God bless you. We all need that. So, so the acknowledgement that some businesses, sole proprietorships, very small businesses have been left behind, and applying some of the CARES Act funding that we've received from the Fed to small businesses with this new program opening up on Monday, I think is really important. My only caveat to that, and I sort of posted a critical remark when this was announced, is that when these programs come about, I would just encourage, or any changes in existing programs, that we would, as council members, and really sometimes the first call among our constituents, that we just be informed of the program, so we have the ability to answer the anticipated questions that come in. Because when questions started to come in, I don't think I'm the only council member that feels this way, that we didn't know how to answer questions. We didn't have a briefing or a detail of the small business relief program. So as we move forward, if your agency and the administration could, which has done a really good job of keeping us informed, but there are certain things that have rolled out that we just don't know about until they're announced. And it's hard for us to provide service to our constituents.
That's on me, Councilman. I should have briefed the entire council when we had those definitions. I apologize. We've been trying to get closer to you now, particularly as you guys have become a partner in helping us speed this thing up and get it out the door. But frankly, as I've talked to some of you, Izzy and Tom, about you can think of our department a little bit like you can think of Dr. Branch and Chief Rund and some of the emergency responders. We're in that hair on fire mode too, and it's not people bleeding to death, but it's people losing their livelihoods, and we're not always in the mode where we're dotting all the I's while we're trying to get it out the door. And this grant is certainly one of them. We deliberated deep into the night for a long time about how do we do this, and how do we make sure that our minority businesses are included. So we have a target now, and now we have a plan to execute getting to those minority businesses. But I should have circled back to you, so I apologize that I did not give you that briefing before we announced it. But really, the ink was still wet while we were announcing it. And frankly, as the questions, you have been sending your constituents into our website to ask questions, which we greatly appreciate. We've been building up frequently asked questions and answering them. And we had a question earlier today that was like, okay, we hadn't anticipated that. We got to figure this out and answer it, which is the purpose, because you can't make it perfect in the go round, and it won't be perfect in execution either. But you guys have been a great partner in it, and I've committed to showing you where all these grants have landed, and I'm going to show you in your councilmatic districts where these things have landed. We're getting ready for really a flood of incoming, because we know how high that demand is. But and you've been great about sending everybody to the website to learn more information, because our staff can't field questions anymore to show favoritism. So I will be sure that we get that information to you and keep you guys in full partnership.
And I did read through the FAQs last night, and it's fairly exhaustive. I know you can't anticipate every question, but it's a really good FAQ section there that you can link to off of the overall program page. So we do appreciate that, and anything that we can do to help our businesses in our community to know about this, get themselves prepared for Monday. My hope is that we do not follow the lead of the unemployment insurance program and have the website so inundated that it crashes. So I hope we're prepared for that as well. And I'm just gonna wrap up by talking about something non-COVID related. And we can't talk to you that often without mentioning TradePoint Atlantic. And I want to let the members know that I've been in touch with executives at TradePoint, as I know Will has, and we should be encouraged in that TradePoint is telling me that they are well ahead of their goals and their requirements for job creation under the infrastructure agreement that we did late last year. And so I think that we should feel good about that investment. And I expect TradePoint sometime in the first quarter of 2021 to give the council an update or a briefing on their job creation numbers and how they are still on pace and actually ahead of the pace for reaching the requirements under that deal that was constructed again late last year. So we should be encouraged by that. And they also report to me that their pipeline for new tenants is very vibrant, still active. I think that they're going through what we're all going through. Some of these corporations that they're dealing with, the council for the corporations is in one time zone and operations is in another, and some are in different countries. And so having to do everything virtually without people flying into the site, I think has presented a bit of a challenge for them. But they're reporting that their pipeline is full and very active. So just wanted to give a quick TPA update as far as what I know to the council. So I'll wrap up with that. Will, thank you and your agency for everything that you're doing. I know that this is a tough time and that you guys are burning candles at all ends. So thank you.
Thanks, Councilman. Thanks for everything you're doing down at TradePoint Atlantic as well. You know, as Steve Walsh, I don't know if Steve's come through yet, but as he's heading into retirement, Steve and his team have really been instrumental in getting those infrastructure pieces done. I mean, the county has a lot invested there, but Sparrows Point Boulevard, Northern Sanitary, Beth Boulevard, those extensions that let trade and jobs come through that peninsula. Our public works folks have done a tremendous amount, and so have our finance people to get it done. County executive has been pushing us to do more on workforce. We've got some high-end workforce activities going, and he's meeting with executives at TradePoint this week as well to see about this big port grant that we're trying to secure for them. We're trying to go after millions of dollars from the federal government to help them open the port. So thanks for everything you're doing. I think there's more to come down at TradePoint. We're certainly still pursuing new tenants, which is exciting while we're dealing with COVID.
Anderson, are you through, Councilman Crandall?
I am. Thank you, Chairwoman. Thank you, Will.
Thank you. Councilman Marks, did you have questions?
Sure, thank you. I just have two questions. I hate to sound like Scrooge here, but explain to me the rationale of giving out $1,000 only to artists, only to one group of workers. I mean, there's a lot of people affected by this, waitresses, cooks, et cetera. Explain to me why artists.
Yeah, that's a fair question. If you look at what we targeted, Councilman, for wages, this is at a $37,000 a year wage. That's a difficult wage to live off of to begin with. Most of the programs that have been rolling out from the federal and state level left out a lot of our independents and our gig workers. Artists was the first group that was identified, musicians, everybody who gets paid when they perform, right? And that's a lot of people. They don't have a boss. They were not eligible for unemployment. So we saw the state take action on this and several other local districts. So we have folks who were already at a very low wage, who saw no light at the end of the tunnel. And we saw that we had a way to make a small investment in them while they're waiting to survive. That's why we did it. Fortunately, the state fixed that unemployment system, or at least knock wood, it's working. So now your independents and your gigs that you don't have to be an artist, you can just be an Uber driver, you can be a sole proprietor. They're getting through that unemployment system, which means they're getting their state benefit and $600 a week more. So they're being made whole as well. So the rationale for that program was we're building a program that we saw a need for when we saw the need. It's not an exorbitant amount of money. It's $100,000, but we know it's going to be put to good use in that community.
Yeah, fair enough. And I know we've done a lot of work in Catonsville and other places on arts districts. So I just wanted to ask that. My second question goes back to grants. And some of these are taking a hit, and quite frankly, now is the time that we might have to cut back on some of these, but some of them are going up. My old favorite, Baltimore Clay Works, is going from $7,300 to $13,000. Some of, just look at these other ones that are going up. The Zoo goes up. Center Stage is going up. I mean, is this the time really to be increasing? I can get keeping them the same level. I know they're taking hit. Time increasing some of these allotments.
Well, I think you're seeing some pretty modest, I think you're pointing to some pretty modest increases here. When we saw a $500,000 decrease over our commitment to these major organizations, a multi-year, I think we moved in the direction that the council wanted us to move in. One of the things that we're very worried about is how fragile these types of organizations can be to begin with. And we know that our Baltimore County residents are the largest users of a lot of these institutions, some of which are free or diminished fees because of this level of support. Plus, our level of support helps catalyze them to go raise other money and show that they've got major investors coming in from their city and county. So I understand your concern. I think it's a place that we need to not cut. Obviously, it's in my space. I'd like to see investments rise here, and our ROI study showed that as well, that this is not just quality of life issues for our county and our region. It's economics, that as these places are healthy, they hire and they draw people here.
Yeah, but some of these, I've made this point before. I don't know how many of our school children are going to the Clay Works. That went up, looks like, by 40%. The Maryland State Boy Choir, I mean, that went up by $2,500. And I don't want to be here like I'm attacking arts. And I do think the county has a responsibility to help city-based institutions as part of a regional arrangement. But I don't know how many of these that are going up are really being patronized by Baltimore Countyans and specifically students. I think that's a discussion the council maybe should have. Thank you.
I think that's fair. And then, these are recommendations that come from the community itself. They're coming from our Arts and Sciences Commission that makes these recommendations. And I think those are fair questions to be throwing into that process, Councilman.
The budget goes up from $2.53 million to $2.58 million. Okay, thank you.
Thank you.
Councilman Marks, I agree with you. We've had these conversations before. This probably isn't the forum to have a complete conversation. However, I know that some of these organizations are probably fragile right now, Mr. Anderson. I won't disagree with you on that, but I know that we have so many small businesses and people that are in a fragile state themselves within Baltimore County. And for all this money to be leaving our jurisdiction, especially into Baltimore City. And I will, I think, David, you may have been a part of the meeting when we went with, when we met with the BSO the last. I asked for an exact amount of, I wanted the numbers of how many of our Baltimore County students had visited the BSO within my district that year. And the answer was no classes in my district actually went to the BSO. However, one of their special, I guess, segments or something that they were doing special, they had visited just one of my classrooms within my district. So I always say, you know, when they say, you know, our citizens, our Baltimore County citizens take advantage of these organizations, I think that we need to look further into each and every one of them and how many of our students or how many of our residents in Baltimore County are actually visiting these institutions. And I think that this is the year, I'm sorry, I'm going to disagree with the administration. This is the year that we do not increase money going out of our jurisdiction. We need to keep it here. And I'll end with that. Is there anyone else that has any questions or comments for Mr. Anderson? I don't see anybody with.
Madam Chair, I have a comment.
Yes, Councilman Batoka.
Yes, thank you. It's a comment about anchor institutions. So anchor institutions, the nature of an anchor institution is that they don't move. They're anchored. Unlike a supermarket is not an anchor institution because it can move. Or GM is not an anchor institution because certainly it can move. But our hospitals, our community colleges, and facilities like that, they're the anchor institutions. And so how, I'd be interested, Mr. Anderson, just in your thinking, especially with the economy of the future and our existing anchor institutions. Certainly healthcare is part of the economy of the future. Chair Bevan said she had an anchor institution hospital in her district, Franklin Square. Councilman Jones has Northwest Hospital. And while we have these really strong healthcare facilities that are part of the economy of the future in place and throughout the county, at the same time, we have a shortage of healthcare professionals like nurses. And I'm really worried that post-COVID, that shortage is going to become greater. And I was just wondering what you're thinking of, what your thinking was, and how we can strategize and do the right thing, that we do bring this well-respected profession of being a nurse to Baltimore County. I know that there was such a shortage when I worked at LifeBridge Health. You could get a bonus if you could recruit a nurse to come work for LifeBridge Health. So I just was interested in your thoughts on our thinking related to that moving forward.
Yeah, I think two things come to mind, Councilman. One is my mom. And my mom was a maternity nurse for 5 years. And I watched in her career through the 80s and 90s, watching this very thing play out. Not enough nurses, too many nurses, not enough nurses. And a lot of it's tied to the education piece. We're fortunate to have education at this 2- and 4-year level that are ready to ramp up and are trying to ramp up in nursing to meet the demand. I know University of Maryland has always had a problem with enough faculty to bring out the nurses. We have more need now than ever, to your point. And I think you're going to see at our school system level and at our college level, you'll see an increase. We're doing some things on a workforce side to try to push it with with BAC, the Baltimore Alliance for Careers in Healthcare. We're doing a demonstration project to coordinate hospitals and training and get people into those pipelines. So we need it more than ever. It's a good point. It is a cyclical wave that hits even in normal times, and we are not in normal times. But fortunately, we have a population and we have great training, and those are two of the pieces that you need to map up against a great healthcare system like what we have in our area.
I'm really worried because of the trauma that nurses have faced and doctors and other medical professionals, and how that impacts like some of the areas that were impacted to a great degree, like New York, New Jersey with COVID. And if they find themselves in a shortage of nurses and other healthcare workers, do they start to recruit
Start pulling them out, like what
people that were from areas that didn't receive, that weren't as impacted as significantly as they were? And so just to put on your radar screen that that's something we should start perhaps to look at incentivizing. One, because it's great to have healthcare professionals live in Baltimore County and also work in Baltimore County. And just something to think about, and perhaps tying in maybe in conversation with Dr. Kurtinitis on how we can maximize our opportunities.
I think that's a great recommendation. We're getting closer. Anytime there's a recession, the community colleges go nuts. They get more and more busy, and our community college has been super active. And I think but it all ties into quality of life stuff. So our county executive trying to solve our needs on the school side directly relates to families that want to stay here because they know they've got great school facilities, great teachers, and one of them in the house is a nurse. So it does all tie into economic development. So I think it's a really good point that you're bringing up.
Thank you. And again, like I said, the anchor institutions aren't going anywhere. And so hopefully, if they are going we're in a really bad place.
I'll give you one anecdote. Social Security, Social Security is a huge employer for us, and a lot of your constituents work there. And other states are constantly trying to pull that institution out, unroot and anchor. And one of the things that we worked on as a county with Senator Mikulski was to get them to make reinvestment in Woodlawn and make it even that much harder to uproot that anchor, which was successful. So you're right. The idea is invest in somebody who can't leave, but even at that behemoth level, other people would like to take them. So
well, I know that we have a lot of second district residents that work at Social Security because of the turnout at the Woodlawn early voting centers for second residents. I'll stop right there.
Thank you, Councilman Batoka.
And Will, that was one of the first projects I had the pleasure of working on with you, making sure we stayed there while I was chief of staff at Social Security.
And thank you for doing that. I don't think people realize how important that work was that you were doing over there. It could have been an anchor that is getting uprooted and yanked out to West Virginia or something like that.
Well, they tried to
That's the plan.
They tried to do the same with McCormick, correct?
They did indeed.
Yeah. Any other council members have any questions or comments for Mr. Anderson? You got pretty lucky today, Will.
It was good following Dr. Branch.
Yeah. Well, thank you so much for all the work that you're doing. Please thank your staff on behalf of the county council, and keep up the good work. Let us know if you could send us a quick email next week about how many small businesses apply for the grant money. I'm very curious about that, and I'm sure the other members are as well.
Yep, we open up next week, and as soon as we can come up for air to count where we're at while we're processing, we'll be tying you back in. So thank you, Madam Chair.
Okay, thank you so much, and we'll see everyone again on Monday at 2 o'clock, starting with Public Works. Everybody have a great week.